in terms of
Okay. We have an op.
no, I'm all for
Yes.
patients being very well educated about their conditions.
Mm-hmm.
But I think I think the introduction of AI has been both. It's been a very good thing and a bad thing.
Okay.
Because what essentially it might have enabled is
I can see where you're going with this.
over researching your condition, and especially jumping into I think if in terms of if I was to explain it like this, it's like the idea of how back in the day people would say like you shouldn't use Google as your doctor because you'll find out the headache that you've been having is a brain tumor.
Yeah.
And I think so tech to a certain extent has been a good thing, but it can also make that worse.
Okay.
So I think mainly I'd really just say, please, like, listen to your healthcare provider. Indeed, do the research on your condition.
Yeah.
But then that information that you're looking at definitely needs to be translated by somebody who's well versed with the language. Yeah.
And actioned. Like
Yes.
we're not just reading to read.
Yes.
If there is something, we need to solve that problem or treat whatever is happening.
Yeah.
All right, now that you mentioned AI and technology, what are you liking? What trends are you liking in healthcare? Let's digital health. Are you liking some technology? Is there technology you're not enjoying personally? Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough information to help you make an informed decision. As always, I am Dr. Hope. These are my handles if you're looking for them. And today I have a lovely guest. He's called Dr. Taio. And you might have seen him on socials. He does some fun things there. But I'll allow him to introduce himself so that you can get to know him a bit better. The floor is yours.
Thank you. Thank you for having me today.
You're welcome, sir.
My name is Dr. Taio Opakunle. I'm a
Just say the second name.
Opakunle.
Opakunle.
Yes.
Okay.
But Dr. Taio is much simpler.
Okay.
I'm an internal medicine resident, so it means that I'm currently doing my training to become an internist or a physician.
Okay.
I'm a content creator where I like to have fun in terms of talking about medicine. So I make funny reels, I guess, with regards to what it's like being a doctor. And then definitely from time to time, I'm really passionate about patient education. Then I'm also a voiceover artist. I'm also a voiceover artist.
Okay.
And so that means things like, when you listen to an ad and you hear, the voice that's talking about, oh, take this and this and this, and it will do this, 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 and this.
Yeah.
That's something which I actually really enjoy doing.
Have we had you before? Can you give us an example of maybe one of your projects?
No. The few projects that I've done have been quite niche.
Okay.
So
We're sorry.
so one of them included it was an ad for a Jabba juice.
Okay.
Then another
So interesting.
one of them was I was an extra in it was a German movie in which they needed English dubbing.
Okay.
Yeah, so I was just an extra in the background for a party. Then I've done some ad reads for like charity runs. Yes. But it's something which I have to balance between working and then of course expressing myself creatively.
Okay.
Yes.
You'll tell us how you got into that. But before that,
Will do.
I usually have a segment called A Journey to Inside Out, where I ask the guest of the day, where are you emotionally or mentally? First of all, have you watched Inside Out? The movie?
Yes, I have.
Good. Yeah, so where are you emotionally or mentally right now as you speak?
So mentally, I'd say I'm in a very good space.
Okay.
My work is quite stressful. And as a result of that, I've had to learn a lot of different ways in order to manage the stress that comes with my work.
Okay.
And so one thing which I've, especially last year, one thing I really had to like experience the definition of is resilience.
Okay.
Is showing up even when it's really hard. And resilience is not fun.
It's not, but it's necessary.
It's very necessary.
Yeah.
And the interesting thing is, you can only know if you are resilient unless you are tested.
Yeah.
Is the thing.
Yeah.
Like you can't know if there's no point of having a ship that stays at dock. The ship has to. You can only know the reliability of the ship once it's out there in the wild seas.
Yeah.
So I'd say where I am mentally, I'd say yeah, I'm in a pretty good spot.
Okay.
Then emotionally, that varies quite a bit.
That's the hard one.
Because once again, especially because of my work, in terms of dealing with a lot of difficult patient situations. And this is just to say that doctors are not heartless.
Yes.
We do not move from one patient to the next, especially when there are bad outcomes, as if it doesn't affect us.
Yeah.
It really does. Because being a doctor means caring for other people. People unload their pain, their burdens, their hardship, especially with regards to their health, onto us.
Yeah.
And it's a lot to carry. It really can be a lot to carry. But I don't think there's anything more noble than that.
Okay.
Yeah.
I think every doctor should be in mental therapy, or should have a therapist, or just prioritize your mental health. I think it's so important.
I 100% agree with you.
Yeah. Okay. Now, let me take you to the doctor's seat. So we have a segment where if we have doctors as guests, we have the doctor's seat. If we have someone who's not a doctor, we have the patient seat. Yeah. Because at one point in time, you've been a patient. Yeah. Okay. So the first question is, if you had to explain what you do to a 4-year-old, how would you do it in 1 or 2 sentences?
What I'd say to that is, people come to me when they're in pain, and I do everything that I can to take that pain away.
Okay.
Yeah.
Next question. If you were to rate your top 5 medical specialties, which ones would they be and why?
Okay. That's a fun question. So at number 5, are we talking like the major specialties or even subspecializations?
You decide.
Okay.
Yeah.
So at number 5, I'd go with pulmonologists.
Okay.
I feel like when it comes to critical care, we don't talk enough about the lungs. And when your lungs aren't functioning, that's it. Pandemonium. Yes. And pulmonologists play such a critical role in terms of, especially in critical care, managing critical care patients. So I've gained such a huge respect for them.
And now with vaping culture, it's about to be a booming business.
Yes. Then next, I'd put at number 4, I'd put dermatologists.
Okay.
Because dermatology is way more than just skincare and acne and removing dark spots. When there are serious medical conditions involving the skin, I've seen dermatologists do absolutely incredible things with regards to repairing patients' skin. So I'd put them at number 4. Then at number 3, I'd have to say cardiothoracic surgeons.
Oh, okay.
Yes. Because the amount of stress that's involved with that job is crazy. I mean, to have the ability to open somebody's chest, drain all the blood out of stop their heart, drain all the blood out of their heart, repair something inside of a heart, then close the person's heart, refill all the blood, restart their heart. It's
all I'm saying is I couldn't do it. I couldn't do it.
Yeah,
oh my goodness, no.
Yeah, it is. So I have such a huge appreciation for them. Then at number 2, I would put cardiologists.
Okay.
Yes.
So you like the heart?
I love the heart.
Okay.
Yeah. Because what cardiologists do is just so cool.
Okay.
Like one thing which I enjoy doing, especially at work, is whenever I get to take images or do what's called an echocardiogram. Yes. So just for a bit of education, it's ultrasound imaging of the heart to look at the structure of the heart, how it's functioning. It gives us a lot of information.
I think we'll put like maybe a small illustration on the side so they can see it.
Yes. So with regards to, because one thing which is on the rise is cardiometabolic diseases. So things like hypertension, diabetes,
lifestyle.
Yes. And what that is resulting in is more heart attacks.
Yes, and at a younger ages than we used to see in the past.
Yes. Okay. So watching where I work, I get to work a lot with cardiologists. So watching them unblock patients' blood vessels is beautiful. Yes. And then Number one is internal medicine or internist. Yeah, I have to. I don't
agree.
My people.
I don't agree.
I have to rep my people. Yes.
I don't. Not pediatrics, obstetrics and gynecology.
So. Okay,
ophthalmology.
No, not ophthalmology.
I feel like ophthalmo was so cool, but it's too precision focused. Like, ooh, I can't see well already. I'm sorry now.
Yes.
Okay. We'll take it. It's okay. IMED can be your favorite specialty. It's fine.
Yes.
Okay. Then the next question is, if you won a grant today, what problem are you solving?
If I won a grant today, what problem would I solve? That's a good question.
Everyone wants money. Now you've been given the money. What are you doing with it?
What would I solve? What I'd really aim to solve, because something which is growing in prevalence, actually is obesity.
Okay.
So if I could set up programs that would have everybody of all age groups to be much more active, because exercise has, if there's one lifestyle change that's almost kind of like a miracle hack, it's exercise, in terms of all of the things that it does to keep you healthy. So what the issue that I'd solve is I'd drastically encourage or put into place programs that get people to exercise.
Okay. I think when you get the money, my recommendation as someone who would use those services, we need more green spaces, and green spaces that have like space for like physical activity.
Yes.
So when you get the money, please remember us. Then the last question before we start.
Yes.
So our episodes go up on Wednesdays. So we decided to have Swahili Wednesdays. So do you understand Swahili first of all?
So
which system did you do?
So I did A levels.
Okay. Yeah. Did you do Swahili?
No.
Who? Let's see.
Okay, let's give it a try.
Ukitumia lugha ya taifa. We'll assume your lugha ya taifa because you're in Kenya. You were born and raised in Kenya is Kiswahili. Tueleze mada ya leo. Mada being topic, the topic of the day. Let me leave it at that. Tueleze mada ya leo.
Wait, so am I supposed to?
Yeah, explain the topic of the day. In Kiswahili.
I think Kiswahili. Okay.
T for tough.
T for very tough.
Okay. We'll give you a pass this time.
Hallelujah.
Yeah. But hey, let me see if I can do it. Mada ya leo ni kuongea kuhusu vitu mpya. Vitu ambazo tunaona na tunapenda katika uwanja wa afya. What we are liking and seeing in the space of health.
Wonderful.
Hey, I wish that's how Kiswahili was taught, or rather was examined in school, because it wasn't that. So for today's episode, we just want to talk about some of the trends that we are liking in the health space, new innovations, new things, and also some things we're not liking or enjoying. So to start it off, I think what I'm liking currently is healthcare workers and providers stepping outside the space of health.
Yes.
Now, you mentioned voiceover. How did that start? How did you fall into that space?
So if I was just to big myself up a little bit,
Big up yourself.
I've always had this very deep velvety voice.
Hey, velvety.
Yes,
Wow.
yes.
Okay.
I never used to think too much of it. But as I continued to grow older, people would tell me, "Oh, you know, just like you were saying, you sound like you should be in radio." I'm like, "Me in radio?"
Yeah.
And I've always been. I'd say I'm now finally starting to really step out of my shell. But when I was younger, I always used to be an introvert.
Okay.
So the last thing that I wanted is a lot of attention,
attention.
broadcasting myself to all sorts of people, which is funny because now I'm a content creator. So as that started, as I kept just getting more compliments on my voice, I was then like, okay, let me see if there's anything that I can do with my voice.
Yeah.
And so then I started asking around in terms of like, if anybody knew anything about either doing voiceover or trying to get into radio. And then one of my very good friends, who also just happened to be a voiceover artist, she introduced me to this voiceover community in Kenya known as the Voice Actors League of Africa.
Okay.
Yes.
Are they looking for women? Are they looking with the camera? Are you looking for women? I volunteer as tribute.
No, but one thing which is growing in terms of what companies want is they want more African voices.
Okay.
So yeah.
But they're not telling us.
You have to find yourself into the industry to learn that information. And from there, they provided structured training on how to get into the voiceover business.
Wow.
Yeah.
Okay.
Yeah. So that's essentially how I got into voiceover.
Okay.
Yeah.
And how has it been so far?
It's been tough, if I'm very honest.
Okay, sorry, that's not what I was looking for.
No.
But no, we are real
So
conversations.
the major reason why it's been a bit tough is balancing it with working in medicine.
Okay.
Because what tends to happen is voiceover is something which requires a lot of energy.
Okay.
In terms of, it's all about projecting and communicating something with my voice, and you have to be in the right headspace. You have to have a lot of energy to do so. It also requires, depending on your level of experience, it can take numerous takes to get the exact sound that different producers would like. So the issue that I'm having at the moment is when I come back from work, I am tired. And that you can hear that fatigue in my voice.
Yeah.
But when I'm full of energy, I'll depending on whatever a producer wants, I'd be able to generate that for them.
Okay.
So it's something which I've put on the back burner slightly. But I know especially once I'm done with my residency, I'll definitely pick it back up.
Okay.
Yeah.
Okay. That's so interesting. Please, I need to find that group. I think for me, I wouldn't say I took it as a compliment, but I got reactions about my voice. People used to say I have a deep voice. And because I'm small, they didn't expect that voice coming out of a small person. So I was like, hey. And it would be that thing for Sasa Batman, like, hi, Batman.
Not Batman.
And I'm just like, not Batman.
Not Batman.
Like, I know my voice is deep. It's not that deep, first of all, but I get it's deep.
Yes.
And I think it's nice to see that you can use your various talents and skills in different ways.
Yes.
Okay, so apart from that, what else are you enjoying about doctors thinking outside the box? So like stepping outside the confines of either the clinic or the hospital?
I think what I'm really enjoying about it is the fact that doctors are very talented people. But what tends to happen is that medicine can almost consume us.
Oh, yeah.
In the sense that we then put all of our energy just into practicing medicine. But we are so much more than just doctors.
That's
is
true.
the thing. Like, don't get me wrong, being a doctor it's an incredible privilege. It's something which we've all worked incredibly hard for. But we are not just limited by that. And so it's really, and I think there are a lot of things about medicine which you can actually translate into real life. And I think definitely doctors offer a very interesting perspective into just different forms of art, media. Yeah, so I'm for me, I'm all just for creative expression.
Yeah.
In whatever way, shape, and form that
Okay.
it comes in.
Okay.
So I would say that's what I've been enjoying in terms of seeing doctors stepping
Yeah.
outside of medicine to do other things.
Okay.
Yeah.
I think for me, I'd say social media, but also how they're finding community in social media, where you're getting to like talk and laugh and just make light of
Yes.
certain experiences you've had.
Yes.
I think it's so interesting. It's so fun when, like, for instance, some of the contents that you put out there, you just sit and you just laugh because you've been through a similar experience and it
Yes.
takes you back.
Yes.
So I think I'm
Yes.
really enjoying that when it comes to social media. And I'm also enjoying now those ones who are now using social media to promote themselves.
Yes.
Because
yes,
we're in
yes,
the day
yes.
and age where, please, if I can't see you, I may not know of you. So you really have to just put yourself out there.
Yes.
Yeah. So please, we need more of you on social media. We need more of you. Market yourself, but also teach, the audience and your people.
Yes.
Yeah.
Yes. Yes. That's very
Okay.
important.
Okay. Let's leave doctors now. What are you enjoying about money currently? Or like money conversations, or is it like just the space of like finances and money? What are you enjoying?
So I think I like how there's been such a huge focus on financial literacy, because it's extremely important. I think we're moving away from that idea of money is the root of all evil.
Is it? Is it really?
I mean, granted, money is what you make of it.
That's true. Yeah, that's true.
But it is very, very important in terms of just knowing how to manage it.
Yeah.
And even if you do make a lot of money, knowing what to actually do with it.
Exactly.
And I think if I was to look at it, especially from a health standpoint, in order, like, I think it's very, very important that people manage their money well, especially to take care of emergencies, because
Yep.
health is extremely expensive.
It's expensive.
It is very, very expensive.
Yeah. Yeah.
And so things like especially health insurance, having a good health insurance cover, that's
important.
Yes.
Yeah.
And then I also think it's very important. Like when I think about money, I think about especially investing in means that also would protect your health. I know I'm taking a very health focused aspect of
Yeah.
this,
I think
but I can't.
wholerounded wholeness.
Yes. But I think, for example, as a gym bro myself,
Okay.
I think
We couldn't tell.
for example,
Yeah.
imagine if you spend money on a gym membership and you get all the benefits of going to the gym, from better metabolic health, better sleep, stress management, that will then offset future costs associated with lifestyle medical illnesses.
Yeah.
And that's like one of the ways in which I look at money. And then even just in terms of investing in things like wellness,
Yeah.
take yourself out on a trip, please. Life is
In things that you like. and
yes,
want.
do things that you like, have fun.
Yeah.
Yeah, like money should be a tool that enhances our life.
There we go.
It should not be the sole focus or what dominates us.
Yeah.
And so a lot of the conversations about financial literacy empower us to do that.
Yeah.
But yeah, what do you think?
I think for me, I like the fact that we're realizing that financial health is part of the wellness wheel. You know, sometimes when you think of wellness, in fact, I was asking, what is wellness? I feel like now it's such a buzzword that we don't really understand what exactly it is. But how I like to look at it is the wellness wheel. So it has different elements. Of course, there's your physical health, there's your environment, there's your emotional health, spiritual. There are 8 factors, and financial health is one of them.
Yes.
And it's so important what you're talking about, just preparing for that day, because that day will come where you really need the finances to cater to something. Yeah. So I think looking at it from that perspective, very important for your health. But also, as medics, we're so bad with money. like we're not trained to steward money and like wealth properly.
Yeah.
And for yourself, even now, as you prepare to to finish your residency, I know
Yes.
you'll want to have a clinic.
Yes.
A clinic is not run through air and fumes.
No, it's not.
Money is the main asset that keeps it going and running.
Yes.
And I think it's very important for us to realize that we need to have proper relationship with money and just understand how it flows and how to steward it and how to be good business people. Because I think sometimes we forget that you are running a business.
Yeah.
And that needs money.
Yes.
Yeah.
Yes.
So I think I'm liking that space where we're becoming more financially literate.
Yes.
All right. Now, trends. What trends? Because you've talked about wellness, what trends are you liking? What trends are you not liking that you're seeing currently?
What trends am I? So, in terms of wellness, I think one of the biggest things I think is people being a lot more open, especially about their mental health journey or taking care of their mental health.
Yeah.
So for example, things like I really like when I see people journaling. That is just sitting down to structure your thoughts is such a healthy thing to
Do
do.
you journal?
Yes, I do.
How often?
I would say about once a week.
Okay.
Yeah, once a week. So journaling. And then also just the how there are a lot more conversations just ongoing about people's mental health
Yeah.
and removing the stigma associated with any mental health issues.
Yeah.
Because once again, life is hard.
Hey,
Life is
you can say
hard.
that again. Adulting. When I catch you. Hey.
And I
Yeah.
think it's so important to have grace for the fact that, number one, at some point in my life, I've definitely struggled. And it's not that I'm saying I'm going to struggle in the future.
Yeah.
But I know that there probably will be future struggles that definitely will be unexpected.
Yeah.
And I need to know or have ways in order to deal with that. So the conversations around destigmatizing mental health, especially and mental health access,
Yeah.
I love that stuff.
Okay.
In terms of trends that I'm not liking, I'd have to say there was a big when things like Ozempic came out.
Yeah.
There was a big trend of everybody jumping on these GLP-1 GIP agonists.
Yeah.
Just for just in terms of a little bit of patient education, these medications, what they do is they suppress your appetite, so that you eat less. They reduce what we call gastric emptying. So food stays in your stomach much longer, and so you feel full for much longer. And then it increases your sensitivity to insulin. So there are a lot of people who are jumping on these medications mainly for their weight loss benefit, who didn't really need to. And all medications come with side effects.
Yeah.
Sometimes you do experience them, sometimes you don't. And so when there was a whole craze of people jumping on these medications when they didn't really need it, I'm like, I'm not a big fan of that. Yeah.
Okay.
What about you?
I think for me, a trend that I'm really, really liking is the fitness trend. I don't know where it's come from, but I love it. I love it so much. There are so many running clubs. People are running at 5 a.m. Please continue by all means. I'm really enjoying it. And I think it really just encourages you to, participate yourself as well. So I really like that. I'm also liking the trend where people are starting to understand their relationship with alcohol. And they're being more conscious about how they consume alcohol and how it affects them. And I've been seeing this trend about in your 30s, when you get to your 30s, it's like, ooh, if I drink today, the next 3 days, it's honestly, and you're just like, it's not worth it. And also the anxiety that comes after a night or a day of drinking. So I just like that we're being more aware in that perspective. Trends I'm not liking. Vaping. Guys, we need to relax. We need to slow down. Yeah, we need to slow down. And I think it's been masked by how it presents. It smells nice. Like, it's not like a cigarette where the smell alone is enough to, tell the person, like, please just step aside. Vapes like whatever the flavor and all that, it smells nice. Even me, like when I'm near someone who's vaping, I'm just like, wow, that really smells really nice. Yeah, but I think we need to slow down on that. Yeah, your lungs need to function, and as you mentioned, lung health is so important.
Yes.
Yeah, so I think I would say that.
Okay.
All right. Next, when it comes to lifestyle choices, what are you pro? What are you not pro?
So when it comes to lifestyle choices,
Yeah.
what am I? So, gym.
Yes. A
Like,
gym. Okay. Clearly.
I might talk about gym a lot.
Yes.
But that's
It's
because
fine.
I'm a very big
Is that a
proponent of
coping
exercise.
mechanism?
Yes.
Okay.
Yes, definitely.
Okay.
I would say it's a positive coping mechanism.
Yeah.
Although
It can be everything in excess can be
yes,
negative.
yes.
Yes.
Because you can overtrain.
Yeah.
It's almost like or the whole idea of replacing emotional pain with physical pain.
Why would you do that?
No, that's partly like I think movement is medicine, and I think sometimes it's important to turn different kinds of energies into something else.
Okay. Okay.
So that's kind of how I look at it.
All right.
So yeah, so exercise. Wait, just remind me.
Lifestyle choices. So you said exercise.
Yes. In terms of things which I am not a fan of. Let me see.
I have mine. Let me see mine as you're thinking.
Go for it.
I think, guys, we need to sleep more. Please, let's sleep. Sleep is so important. Sleep is so yummy. Sleep is just, it's that free medicine. Like you never have to pay for it. So please get your rest. Sleep. Yeah. So I'm really not liking people not sleeping. Please sleep well and make sure it's good quality sleep as well. What I'm liking though is should I say it?
Go first.
I'm trying to think. I'm trying to think. I don't know if it's a lifestyle choice, but people just becoming more aware of their health. Yeah, I like it where you're able to ask the questions. You're able to not counter what your doctor is saying, but just be like, why? How does it affect me? The proactiveness. Yes, I like how people are being more proactive when it comes to their healthcare and their health. Yes.
And actually, it's interesting that you say that because that was actually one of the cons which I was going to talk about.
Oh.
In terms of...
Okay. We have an up.
No, I'm all for
yes.
patients being very well educated about their conditions. But I think I think the introduction of AI has been both, it's been a very good thing and a bad thing.
Okay.
Because what essentially it might have enabled is
I can see where you're going with this.
Over researching your condition, and especially jumping into I think if in terms of if I was to explain it like this, it's like the idea of how back in the day people would say like you shouldn't use Google as your doctor because you'll find out the headache that you've been having is a brain tumor.
Yeah.
And I think so tech to a certain extent has been a good thing, but it can also make that worse.
Okay.
So I think mainly I'd really just say, please, like, listen to your healthcare provider. Indeed, do the research on your condition.
Yeah.
But then that information that you're looking at definitely needs to be translated by somebody who's well versed with the language. Yeah.
And actioned. Like we're not just reading to read.
Yes.
If there is something, we need to solve that problem or treat whatever is happening.
Yeah.
All right. Now that you mentioned AI and technology, what are you liking? What trends are you liking in healthcare? Let's digital health. Are you liking some technology? Is there technology you're not enjoying personally?
So AI has actually been such a great addition. I know I'm going all over the place. But it's made especially when you train your AI algorithms, especially to give you evidence-based search results essentially. And so it's also just made the process of looking for information a lot easier.
Yeah.
And the good thing with AI is that it's especially able to take a lot of variables into account. And so it's something which yes, it has made practicing medicine a lot easier, because we're able to search for things that we need to find or we need to consider a lot faster.
Yeah.
Um,
Apart from searching for things, do you guys apply AI? How do you apply AI in internal medicine currently?
So it's mainly just it mainly just for research at the moment.
Okay.
Yeah.
And a bit of diagnostics, yeah.
Diagnostics, we still like just doing it the traditional way of
Yeah,
having
you
to do
said
your
you
own.
cannot replace me.
No, we're not going anywhere. And as
Yeah.
far as I'm concerned, at least I don't think AI is going to replace doctors,
Okay.
because I think,
There's someone who disagrees. I think it's Elon Musk.
I mean, you can disagree, but at the end of the day, I think
We'll see.
you can't take away that human aspect
That's
of
true. Yeah,
of
I think I
medicine.
agree with that.
Yeah.
Yeah. Okay.
So yeah, mainly just with regards to optimizing, just searching for information that we need, or especially for studying,
Yeah.
it's made studying a lot easier.
Definitely. When you guys were in med school,
Yes.
did you guys have ChatGPT?
No.
Do you think you would survive right now as a student in med school? Would you be learning? Do you think you'd be learning?
Oh, that's a really tough question, because it's so easy to just copy paste a question that you've been given either for an assignment or anything like that, and just input it into an AI, and it just gives you the answer for it. Or even to just flat out do your assignments and things like that. At the end of the day, you need the information to be in your head.
That's true.
Like in terms of doing exams, the AI is not going to do the exam for you. So I still think that aspect of the fact that so much rote memorization is needed, especially with regards to medicine, I think shouldn't affect medical training. But I can clearly see how it can be very easy to offload all of the studying onto an AI.
Me, I would struggle. You've gone around the bush. Me and I would struggle, because I don't think the information would sit in my head.
Yes.
Yeah, because I think I'd just be generating what I want and maybe like perusing or skimming through, but I don't think it would actually be sitting in my head.
Yeah.
And then also, I'm a writer, so as I'm reading, I'm writing.
Yes.
If I've not written, I haven't read. Yeah, so I think I'd really struggle.
Yes.
Yeah.
Yes.
Okay. Let me see. Is there something you're not enjoying about technology today in relation to health?
I think not so much actually, because things like telemedicine, I mean mainly telemedicine, like I think is really a good thing in terms of how it's creating easier access to accessing medical professionals. And I think right now for me, not too many negative things with regards to tech and AI, because before it becomes integrated into daily practice, it's scrutinized very heavily.
Yeah.
So it's quite hard to introduce something that might be slightly detrimental, because so much research has gone into ensuring that it's beneficial.
I would say yes and no. I think now it's so easy to produce a product, even without it going through such a gruesome process of verification and just ethical values and to see if you align.
Yes.
So I'd say that I don't think it's that hard these days. But also, if it's going to be adopted to maybe like national level or like global level, that's when I think the intense grilling comes in. So there's two parts to it.
Yes.
Yeah. Okay. I think for me, what I'm enjoying is wearables. Wearables. Whoever thought of wearables, my goodness, the watches, the rings. I want an Aura ring. What
is that?
It's just like a watch, but now it's a ring.
Oh,
yeah.
Okay.
So it monitors your vitals basically and how you sleep.
Yes.
Yeah. I just want it because it's cute. That's it. Yeah. I
Not
really
for its
shouldn't have it. I already
functionality?
have a watch. Functional. It just functions the same way as a watch. Yeah. So if you have one, I don't think you need an Aura ring.
Yeah.
But I think wearables are some of the most innovative devices out there. Like wow. But then now the downside is now data collection. Your data is everywhere. all over the place. People are
Yeah.
collecting your data.
Yep.
And I think every time I speak to people who are in the tech space,
Yeah.
one of their greatest concerns is there's so much data out there and people are not grasping the importance of data minimization.
Yes.
And I'm just there like, but they already have our data. Now what do we do? Like they already have it. Yeah. So I think I'm enjoying it, but also there's that question of, okay, fine, where does my data sit? How is it being used?
Yes.
And that whole shebang.
Yeah.
Yeah.
Oh, okay. Interesting. Yeah.
Okay. And then also I'm liking the fact that such tools are helping like now insurance providers to be able to assess your habits and that also
Really?
yeah, because there are some insurance providers who actually give the wearables to their clients
Really?
so that I can see what type of risk you are to me.
Because what I'm used to
Yeah.
is when somebody's trying to get a new insurance policy, they'll say go and be reviewed at a doctor's office.
Yeah.
We then take vitals, we do a chest X-ray, all of those things.
Yeah.
And then we give them our verdict about
Yeah.
okay, is this person in good health or not? But I didn't know that's something that's now being
Yeah.
incorporated.
Yes, maybe not here so much, but in more modern countries. But I also know there's some insurance providers who are having that conversation as early as 2023. I don't think they've adopted it yet, but just think about it. If I'm able to see through your activeness, your diet, this is your lifestyle, I can tell in the future what kind of risk you'll be to me. And that should, in my opinion, it should be able to influence your premium. Because if I'm doing everything right, then I think, yeah, you should also do right by me.
And the premium should
Yes,
be lower.
give me, yeah. It is because then that means you're less of a risk
Yes.
to them than someone, because we talked about your lifestyle choices contributing so much to your health outcomes in the future.
Yes.
So if I know that you're putting in the work to not have negative health outcomes, why shouldn't I incentivize you? And also, I think we all work well with incentives.
Yes.
If you're telling me that if I do this, my premium will be less, I'm going to do it.
That would. So actually,
Yeah.
let me actually run something by you.
Okay.
Sometimes, just in my random thoughts,
Yeah.
I've thought like, what if, or okay, let me pitch this almost like a TV show. What if
Yeah.
there was a TV show that was about how if your doctor like saves your life,
Okay.
then they are entitled to, I don't know, like
Entitled is a big word.
I know it is.
Okay.
But it's just like they're entitled to, like, for example, like 10% of your assets for the rest of your life as you live.
Your individual assets.
Yes. Do you think that would incentivize people to live healthier lives?
Probably. But that's like by force. Yeah, that's you're being a dictator at this point.
But to a certain extent, in terms of what you were saying with the insurance, isn't it kind of like that where it's like, okay, for the fact that you're living a healthier life, your premiums are less.
But that makes sense.
I mean,
because it's a service.
Yeah, from a business point of view, it definitely makes sense.
Yeah. And then also because insurance is so much based on like risk assessment.
Yeah.
Probability, like, you know.
I mean, insurance is a money-losing business venture at the end of the day. Yeah. Or at least from what I've heard, most health insurance branches of insurance companies usually lose money. Or
okay.
Or
I don't know unless they tell us, but I think I don't see that way.
Really?
Yeah, because if you have, let's say you have 100 people who are insured under you, and in a year, let's say 10 people claim. First of all, they're not all going to claim the same amount.
Yes.
They're not all going to have the same problems. There's definitely that one person who will have a very high claim.
Yes.
But there are also those others who will just have smaller claims.
Yes.
So I think I wouldn't say it's a money losing business. Yeah, I wouldn't say so. Yeah.
Okay. Because maybe I might be.
But then again, I don't know.
Yeah.
I don't know. Maybe if I see their fact sheets, we'll be able to assess.
Yes.
Yeah.
Yes.
Okay.
I think it's because where I work, I see very, very high patient bills.
But insurance doesn't cover most of them in their entirety.
Yeah.
So, and I think maybe if they were to cover your total bill, it would be a money losing business.
Yeah.
But now because they have caps.
Yes. Yeah.
Yeah. Maybe that's how they're protecting themselves.
Yeah.
Okay. Okay. Going back to if the doctor should, because
I know it's a crazy
we have to
idea.
revisit there. Why is the doctor entitled to equity in your investments or whatever you own, your assets, and you're paying for the service? It's not free.
No, but then the thing is, this is specifically in a scenario where they've saved your life, like you
Okay.
weren't gonna make it,
Okay.
and they did everything that they could, and now
Yeah.
you're alive.
Okay.
And
Is it because you say life is priceless?
I mean, no, but then the thing is, if somebody kept you alive, and then because of that, you can still go ahead and live your productive life. Completely hypothetical.
It's a giving God complex. It's a giving.
So the thing is, like,
Yeah.
the reason why I even brought this up is because, like, almost like as a thought experiment, is what lengths would people go to maintain their health so that they don't have to go and see a doctor, and then would that incentivize more people to become doctors?
I think that's a very good research topic. Yeah. But now you'd have to have different incentives and see which one people gravitate to the most, and also which one makes sense. Yeah.
But I think even that's a very good question, because what's starting to happen actually is there starting to be shortages of doctors and healthcare workers all over the world. And so I think that actually would be a very good thing to look into in terms of incentivizing, or what would now re-incentivize people to go and practice medicine again, or to go and become doctors.
I have one suggestion.
Go for it.
Have working systems.
Yeah. Yes.
I mean, I think for doctors to go back into the practice, I think that one is easier than incentivizing people to live healthier. Because the doctors have already told you the struggles, the challenges, and the problems they have.
Yes.
So if we're able to fix those challenges, then I think that would be incentive for more people to venture into the field.
Yes.
But now you're telling me live a healthier life. Here is the incentive. And then you want to take my assets. It's giving tea for tough. It's giving. But I feel like with the direction we are moving, which of course is preventative health, we really have to think outside the box.
Yeah.
Like, what are the things that we can use to encourage people to maintain the healthy lifestyles? Because I think many of us, we fall off, and falling off is not, you don't have a problem. There's nothing wrong with you. It's just that it's kind of hard to maintain a habit. You have to be very intentional about it. But if there's an incentive, I can try harder.
Yes.
Yeah.
Yes.
Okay. Sawa. Those are some of the questions I had. I don't think I have more, but no, I have one. Environment. What are you enjoying in our environment currently, and what are you not enjoying? Me, I can start with what I'm not enjoying.
Okay. What
The dust, the construction, the mosquitoes.
Yes.
I think just the repercussions of over urbanization.
I completely agree with you. Yeah.
I would tell you, you look at what do they see? Is it something by 80 by 100, and someone is telling you 200 apartments? I'm like, 80 by 100, like in that small space. I'm just like, and where the green spaces, where the kids going to play, where people going to water the sun, you know.
Yes.
Yeah, so I think at some point we should say we have reached capacity.
Yeah.
I think some places like Kilimani, we've reached capacity. We have capacity. Yeah.
I think even just to add on to that is also noise pollution. So construction definitely, but also even just the presence of things like clubs and bars in residential areas, especially if they play a lot of loud music late into the night. So that noise pollution is very bad. In terms of I guess positive environmental changes, once again, that's also another tough
walkways. We have a few walkways, pedestrian. Let me tell you, first of all, this is what my sister keeps saying, because she's an engineer. She's like, Kenya hates pedestrians. Like, for real. They're an afterthought.
Yeah.
Because you can't tell me that the walkway ends in a ditch, and then I have to walk on the road. And I used to get so upset when I see people walking on the road, but then you're just like, where are they supposed to walk? They can't fly. Yeah, so I just don't think we're very conscious about pedestrians in this country, and it's very unfair. Even cyclists, it's very unfair.
Yeah,
We need to do better there. But for the few that exist, we are enjoying them.
Yes.
Yeah.
In terms of positive things with regards to environmental, I love all of these conservation efforts to maintain, especially a lot of natural a lot of spaces of nature.
Yeah.
Yes. Because I think to a certain extent, once again, the urbanization of everything is disconnecting us from nature.
Yeah.
And there's something so profound and interesting.
I'm so sorry you say that, and I've just thought, sometimes it's true, it disconnects us from nature, but also you're there sitting wondering why there's a monkey in your kitchen. And you're like, the tree existed there, the monkey knew the tree.
Yes.
And now it's your house. So yeah, we're disorganizing what already existed.
Yes.
Okay.
Yeah.
Sorry, go on.
No, and it's just spending time in nature is just good for you. It's so peaceful, it's calm, it's serene. Yeah.
I had never run at not Karura, Arboretum. I started recently, and I was just like, wow, you guys never told me. No, for real, never told me. I was like, it's so nice.
Yeah, that track that they have there is wonderful.
Yeah, and the way like the terrain it's like these cabro. The thing I don't like about Karura is when it rains.
Yeah.
When it rains, but then I understand also how they want to just maintain the natural habitat. I do understand.
Yes.
By that time they cut trees. Hey, wait, that was too much. That was enough. But I hope we've replanted the trees that we're cutting.
Yes.
Yeah. There's something else that I also don't enjoy. Is so for the construction, and this is something that I learned. You see how places become so dusty, and especially construction of roads. Do you know there's a budget allocated to pouring water to reduce dust? So why are we living in dust? That's just my question. Whoever is in charge of the budget, why are we living in dust? Yani, you can't even leave the house in white. And if you do, you're just so conscious about where you're going to touch because there's dust everywhere.
There's dust everywhere.
And let me tell you, if there are people I just sympathize and empathize with, imagine if you have allergies.
Oh my
You have allergies and you live in Nairobi.
Yes.
I'm so sorry to you because it's unfair. It's not right and it's unfair.
Yeah.
Okay. I think that's it. All right. That was fun.
Yes.
Now let's step outside the clinic. So I have now a segment to wrap up. It's called Beyond the Clinic. Don't overthink your answers. You said you like thinking.
I love thinking.
Stop thinking. Don't think.
All
right. So first question is, if you had to text one simple and actionable health tip to all your patients right now, what would it be?
I think you know the answer.
The gym. He said go to the gym.
Yes. So exercise. Please exercise. Yeah. And especially in terms of whatever works for you. I understand not everybody has the exact same capabilities.
Yeah.
If going for a good 30-minute brisk walk is what your joints, is what your health will allow you to do, by all means do it. But I would really encourage people to build muscle because there's so much research that's coming out that is showing that muscle is the organ of longevity. In terms of reducing things like, for example, especially in elderly people, having increased muscle bulk decreases the likelihood of things like sustaining a fracture after a fall. It increases, especially for the ladies out there, resistance training increases your bone density because that's one thing which is a major problem for ladies after menopause. Because of a lack of estrogen.
There you go. Ding, 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 ding.
Yes.
We just talked about menopause and perimenopause, so that's something. Because of
yes. So yes, please build muscle. It is a metabolic safety net in terms of ensuring all of your organs work the way that they're supposed to, and it will essentially increase your life expectancy.
Correct.
Yes.
All right. Next question. What's the first thing you do for yourself in the morning, or the last thing you do for yourself at night, just for your own sanity?
The first thing I do in the morning, music.
Okay.
I listen to a lot of music. I usually I listen to a lot of, I guess they call it conscious hip hop.
Oh, yeah, I was going to say Afrobeat. I'm sorry. I've profiled you. Okay, what is conscious hip hop?
No, it's just it's music that tends to instead of talking about the usual stereotypical things, it essentially has a purpose to it, or it's trying to they usually talk about, like, very serious topics.
It gets you thinking, in short.
I like thinking.
Don't beat up. I know you wanted to say it. Could you give us examples of artists?
So people like Kendrick Lamar.
Okay.
There's this hip hop group that I listen to called Run the Jewels. Lupe Fiasco. Okay. My all-time favorite.
He still raps?
No, it doesn't.
Okay.
Yeah,
okay.
but
I just remember show goes on, and that was a good song.
So the interesting thing is that in terms of some of the interviews I've watched, he did not like that era of
really?
He didn't enjoy making that album.
Okay.
But everything else, where he expressed that he had a lot more creative freedom, he managed to capture a lot of, in terms of what he likes. Yeah,
I can see that.
Yes.
Yeah, because I think Show Goes On is a bit like popular music. Yeah. All right. Next question.
Yes.
Is there a moment you've ever just thought the body is so wild for doing that?
Hey.
And I'm hoping you can give us a man's perspective, because all the guests have given a woman's perspective, meaning they are referencing the woman's body. Yeah. No pressure though.
So, I think, because the moment you said that, I mean, my mind went into like clinical medicine and everything. I'm actually not like, what exactly do you mean? Like,
you don't understand why and how the body would do that. Like, it just seems bizarre.
You see, that's a tough one for me, because especially as a physician, our job is to understand exactly why the
You're
body
overthinking it. Stop overthinking. It's so simple. Let me give an example. Huh? Just see. Losing teeth when you're pregnant. Imagine a dentist told me that that's not accurate. But I said we'll have to have dentists on here now to give us the accurate information. Yeah, but yeah, something like that.
I'm really struggling, because anything I can think of, there's a reason as to why.
No, you're overthinking. Let me see. I'm
really struggling with that one.
I think for me, like, why do we have to? No, actually, no. Hiccups. Please, why are hiccups necessary?
Oh.
Yeah, because you like to think. Tell us why hiccups are necessary.
So it's not that they are necessary. I mean, so in terms of what causes hiccups.
No, you're going into pathology. Like, why? We could live without hiccups.
Could we live without hiccups? Yeah. They really have no function.
Thank you. Also an appendix.
Okay, well,
no.
There is
how we learn about it is it literally doesn't have a function.
I mean, because the interesting thing is, what's happening is, as we change how we live, certain organs are becoming less useful.
Okay.
So some people think that the appendix was there when we used to eat a lot more vegetation. That it had a major role in terms of ensuring that we could digest that material. But now, as our diets have changed, it's no longer necessary. Okay, now
internal medicine is a field for you. Don't worry.
Now I've come up
You're
with
doing
something.
it
Although the annoying thing is, I know the reason why it happens. But muscle cramps.
And you see, that's it. You can know the reason why it happens, but you're just like, why?
Why?
Yes.
But then there's a
Yeah.
reason as to why
It's okay. It's okay. Your muscles could still function without a cramp.
True.
Yeah.
True. Yeah.
Okay. Hey, I made this for you. Ah. Hey. Okay, let me see. The last question. No. Why did it lock? But yeah, muscle and also period cramps. Like, I get you need to remove the lining, but you
Yes.
can do it peacefully. Like, I don't
Yeah,
see
it
why we
could
have to
be-
fight.
Yeah. Yeah.
Okay. Next question is, what's a piece of health advice that you probably had a while back that you no longer agree with,
A piece of health advice.
or you've changed your mind on?
Oh, I really have to once again do my favorite thing for that. Think. Um, let me see. Oof. I hope we're able to cut out the
Dead
moments
space.
of because I really have to. What's a piece of advice that? I'm really struggling to
I feel
come
like
up.
you'll leave this place and just go and write. So, what is a piece of health advice I really need to?
No, because in terms of with regards to things that I incorporate in my life, I usually do a lot of research around why this is beneficial and why I should do it.
Okay.
So yeah, that's a tough question for me to answer.
Okay. I meant. All right. Last question.
Yes, please.
What's one health rule you think we should break every now and then without feeling guilty?
I think indulging a little bit in like sweet treats.
Okay, why are people enjoying themselves? I think everyone is saying that. Everyone is saying like a cheat meal or like it's food related.
Yes,
Okay.
yes.
Okay.
Because I think as long as it's like that whole no, I don't think that's the right thing to. As long as you're living a healthy life, your body can
Sorry, it's okay.
your body can deal with like a small and healthy meal. Your body can deal with that.
Okay.
So yeah, that's the main thing that I would say.
All right.
Yeah.
That's it.
I'm curious to hear what you would say.
Mine. I think it's okay to have a sad day. Yeah, like it's fine. It's okay to be in the pits every now and then.
No, I think
Yeah.
I think sadness is so for starters, I think all emotions are healthy
Yeah.
as long as they're either not experienced in extremes or for too long.
Or affecting your functioning.
Yes.
Yeah.
Like I think sadness is a very healthy emotion. Because it allows you to reflect on what was it that affected you in such a monumentous way. Like life is, I don't think life is supposed to be all sunshine and rainbows all the time. If it is, it might be manic. is a strange thing.
That's true.
So no, I completely agree with you.
It has its seasons.
Yes.
I think I read something the other day where it said that in life you're either about to have a low moment or like a challenging moment or season. You're either in the challenging moment or the season, or you've just come out of one. So it's literally just a loop.
Yes.
Yeah. All right, that was it.
Yes.
Thank you for joining us.
That was so much fun.
Really?
Yes.
Okay, should do this more. And for you, I need random questions because you're overthinking too much. Too much. Hey, he's like, wait, what is the pathophysiology of that process? No.
That is my job.
No. Actually, I think my health rule that I think we should break every now and then. It's okay not to think.
It's okay.
Like it's okay to do dumb stuff. At least, yeah, every once in a while. It's okay.
mean, people learn more from mistakes.
That's true. That's true. But every once in a while, it's fine.
Yeah.
It's fine.
Yeah.
All right, so we've reached the tail end. You can plug yourself.
Yes.
Where
So
can people
please,
find you?
yes, you can find me on Instagram and TikTok. You can either search my name, Dr. Taio, or my handle is @double.o.
Okay.
Yes.
What type of content do you produce or
So
share?
a lot of the content that I make is actually targeted towards healthcare workers, and just expressing relatable moments in medicine.
Yeah.
And I like having fun just poking at different specialties in medicine and making light of them,
Yeah.
because we always take ourselves a bit too seriously
That's
as
true.
doctors.
Yeah.
And then also I love making informative content for, especially for patients, as well as also content on awareness.
Okay.
Yeah. So anytime there's some World something day, World Cancer Day, World Hypertension Day, World Heart Day, World Diabetes Day, you'll see me reminding people about the importance of prevention.
Okay.
Yes.
You just reminded me. I saw this guy who said, "Can we stop with the awareness? Like it's enough." He said, "Now we're too aware. We're too aware of everything."
Yes.
And I was just like, and we just scratched the surface, by the way. There's so much more to be aware of.
Yes.
But thank you so much for honoring the invite. This was a lovely conversation. I just like picking people's brains just to see what are you liking now, or like what's interesting you, and also what's new.
Yeah.
So karibu sana. And next time you'll have to speak Swahili.
Okay.
So start preparing. Yeah. Okay, guys, that was it. If you've reached this far, thank you so much. Please be sure to subscribe. I'm giving you a minute now. A minute is too much, but please just press that button. Just press it. Thank you so much. Follow us on our socials, A Dose of Health, the podcast, on Instagram, TikTok, also on our other podcast platforms, Spotify, Apple, Amazon, AfriPods. And also follow me, Dr. Hope. My handles will be down here. And that's a wrap.